Hi, my name is Dr. Michael Dim. Are you aware of the epidemic levels of pancreatic disease we're now seeing in our dogs and cats? It's amazing because several decades ago, we rarely saw conditions of the pancreas like we're seeing now. From conditions like something called pancreatitis, which is an inflammation of the pancreas that leads to an activation of the enzymes in the pancreas that start literally eating away at the pancreatic tissue itself and the surrounding tissues, to the immune processes involved with the triggering of that process. Many of our animals are suffering from pancreatitis. We're also seeing record numbers of animals suffering from diabetes, another disease of the pancreas, where there's an autoimmune destruction of the cells that make insulin in our pancreas. So we want to look at what the causes are from a holistic perspective, and then some tips or treatments that might help prevent and or treat these frustrating conditions. Pancreatitis can often lead to severe vomiting or diarrhea, abdominal pain, weight loss, loss of appetite. And an animal that suffers from pancreatitis, whether it's a dog or a cat, might need to be hospitalized for at least a few days, which often costs hundreds, if not thousands of dollars to stabilize these patients. And often the problem often comes back. Many of my colleagues will often say that pancreatitis is due to high fat diets. Now, processed fatty things from the table, like unhealthy fat or drippings from the table, they can be definitely factors in pancreatitis. But what my colleagues are failing to recognize is that animals that are fed processed commercial foods and all the synthetic ingredients in those diets also put tremendous stress on the pancreas because these diets are cooked and processed. And our animals' digestive tracts evolved to eat raw meat. And so when we give processed cooked foods, we put tremendous strains on the stomach, on the pancreatic enzymes to have to process and digest these foods. So sometimes just the act of feeding commercial diets can lead to pancreatitis in our animals. As far as diabetes is concerned, that's often due to an autoimmune process, as I mentioned before. And in those conditions, there are many possible triggers that can trigger diabetes. People often don't realize that even removing the sex hormones, like when pets are spayed or neutered, that can lead to hormonal stresses or hormonal imbalances in the body, leading to thyroid problems, adrenal gland problems, and even diabetes in animals. Other triggers of autoimmune pancreatic diseases and subsequent diabetes include vaccines. Overvaccination can trigger an autoimmune response in diabetes. Various toxins, such as excessive use of flea, tick, or heartworm medications, again lead to an immune response that can affect the pancreas as well and lead to diabetes. As far as treatment of these conditions, it goes back to the basics from a holistic perspective. We want to feed a species appropriate raw meat diet if possible. And we want to also try to eliminate some of these toxic stressors on our patients. And those will go a long way towards lessening the incidence of diabetes and pancreatitis. Also, we want to avoid suppressive therapies. And I've talked about that in previous talks about homeopathy, where if we suppress the external manifestations of immune processes, for example, if we suppress allergic inflammation, hot spots, ear infections, and we use injections or other strong medications to make those symptoms go away on the outside of the body is still sick, and the immune system will often manifest its immune tendencies at deeper levels in the body, whether it's, again, the pancreas or the liver or the kidney. And of course, with the pancreas, we then get, again, increased incidences of pancreatitis and diabetes. So we want to be mindful, again, of these factors, and we want to bring it back to basics by feeding a species-appropriate raw meat diet. Other treatments for these conditions include digestive enzymes, I find are very helpful, especially in pancreatitis. Digestive enzymes seem to ease the workload on the pancreas and actually have a therapeutic role in managing pancreatitis in our patients. There are certain herbs, such as fenugreek and other herbs, again, very good for pancreatitis and diabetes, various nutrient therapies, homeopathy, Chinese medicine, acupuncture, all of these modalities can definitely help put the pancreatic organ back into balance and again avoid using strong drugs. When it comes to insulin, we often can avoid the use of insulin by again feeding the species appropriate diets, as well as again using homeopathy and herbal therapies, fresh whole herbs, and not forgetting the species appropriate raw meat diet. If you have any questions on pancreatic diseases or pancreatitis, feel free to contact me in my practice, which is drdim.com. That's my website, doctordym.com. I offer local in-person consultations here in the West Palm Beach area, and I offer phone consultations nationwide. Thank you very much.